Welcome to Social Security Disability Help. The URL of our website is socialsecurity-disability.org. Today we will be talking about disabling conditions. If you click on the Disabling Conditions tab on our website and scroll down to Mental Disorders, you will find bipolar disorder. Today we will be talking about bipolar disorder and how you can obtain Social Security disability if you are suffering from bipolar disorder. Historically known as manic depressive disorder, bipolar disorder is a mental illness characterized by cyclic mania or periods of extreme euphoria followed by bouts of severe depression. This mental disorder is not a mood disorder alone but a category of several mood disorders. It is a condition that is prevalent in both men and women. Signs of the depressive phase of this mental illness include persistent feelings of hopelessness, anxiety, anger, guilt, sadness, isolation, fatigue, irritability, lack of motivation, chronic pain, morbid suicidal ideation, self-loathing, and depersonalization. In severe cases, individuals suffering from this disorder can even become psychotic. Bipolar disorder symptoms typically manifest sometime between childhood and late adolescence. Ordinarily, bipolar disorder diagnosis is based on an individual's self-reported experiences along with behavioral abnormalities reported by friends, family members, and colleagues. These indications are often corroborated by secondary symptoms observed by a social worker, psychiatrist, nurse, or other clinicians involved in a clinical assessment. Assessment of bipolar disorder is usually performed on an outpatient basis. An inpatient facility admission is usually only considered necessary if an individual possesses a serious risk to his or herself or to others. A preliminary assessment may consist of a physical examination by a doctor. Generally, examinations are not repeated for relapse cases unless there is an indication of a specific medical need. If an individual's bipolar disorder is constant and impairs all ability to function in a work environment, that person may be entitled to Social Security disability benefits. Any individual with bipolar disorder can be eligible for disability benefits if he or she meets the evaluation criteria listed in the Social Security Administration's Blue Book and if he or she has received a medical vocational disability endorsement based on his residual functional ability, education, and age. The Social Security Administration has established that a claimant with bipolar disorder must have a history of consistent symptomatic manic episodes, depressive syndromes, or a combination of both. Additionally, the claimant's bipolar disorder should result in two of the following restrictions: severe limitation of daily activity, inability to interact with others in a normal way, or recurring episodes of decompensation which last for an extended period of time. If a claimant does not meet the aforementioned criteria, he or she may still qualify under a section in the Blue Book which states that any individual with a medical history documenting at least 2 years of any chronic affective disorder, including bipolar disorder, can be granted disability benefits if the impairment or the ailment has resulted in limitations of the capacity to perform basic work action even when symptoms are controlled with psychosocial support and medication. Even with support and medication, the claimant's condition must still lead to persistent decompensation periods, or the residual illness process has caused a subsidiary adjustment that even a nominal boost in mental demands would cause the claimant to decompensate. Furthermore, a claimant must have been incapable of functioning outside a supportive livelihood for any foreseeable time period. If an individual meets or exceeds these qualifications, there is a good chance of eligibility for Social Security disability insurance or Social Security income. If a claimant still does not meet the aforementioned criteria, he may still apply for a disability based on his remaining functional capacity, education, and age. If mental residual functioning is very limited and one is not capable of meeting the demands of basic routine repetitive activities, it is still possible to qualify for a medical vocational disability allowance. Because applying for Social Security disability insurance or supplemental security income with a bipolar disorder diagnosis can be a complex and intimidating process, hiring a qualified Social Security disability lawyer or disability advocate may be in a potential claimant's best interest. Because bipolar disorder is listed in the impairment listing manual of the Social Security Administration, a person with bipolar disorder who wishes to file for disability benefits can win by satisfying specific criteria. If you are planning to apply for SSDI or SSI disability benefits, you should bear in mind that all social disability claims will be granted or denied based on medical records. You should strive to keep a consistent treatment regimen before and during the Social Security disability application process. And if your SSDI or SSI application is denied, you should be prepared to file a disability appeal. In many cases, a Social Security disability lawyer or advocate can provide invaluable help by guiding you through the application and appeals process. Thank you for taking the time to listen to this video on bipolar disorder. And if you believe that you are suffering from bipolar disorder and would like to be contacted by a qualified representative, please fill out the form located on the top right-hand corner of our website. Thank you and have a good day.